Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. In this presentation, we are going to look at Krishna Kumar Kunnath's death resulting from a heart attack and a cardiac arrest. We're going to learn what is an heart attack, what is cardiac arrest, and why do people die suddenly after a heart attack or a cardiac arrest. Before I begin with the main presentation, I want to send condolences to Krishna Kumar Kunnath's family and pray for God to give some strength and tranquility to the family during these testing times. According to the reports, Krishna Kumar suffered a massive heart attack and cardiac arrest. So, what is a heart attack and what is a cardiac arrest? Basically, the heart is a pumping organ in the body. It pumps blood to the rest of the body. The heart itself is getting its nourishment through what is known as the coronary arteries, as it is depicted in the picture here. If there is a total blockage of the coronary artery with a plaque and blood clot, that leads to the death of the heart muscle that is supplied by that region. If a main artery is blocked off, and if more than 40% of the heart muscle is damaged, the heart loses the pumping efficiency. As a result, there is drop in blood pressure, there is reduced circulation to the brain, and the person collapses and may eventually have sudden death. On the other hand, cardiac arrest is as a result of an electrical instability of the heart, leading to what we usually call as ventricular tachycardia, or a rapid heartbeat, which does not generate any blood pressure or have the capacity to pump blood, or ventricular fibrillation, where the heart is just quivering like this. So basically there's no blood circulation to the rest of the body, leading to cardiac arrest and death. So what causes this ventricular tachycardia or ventricular fibrillation? As I said, this is an electrical abnormality which is commonly seen in patients with heart attack, particularly in the early hours of a heart attack, because the heart muscle is very vulnerable and irritable. And it is during this phase when there is a very high chance of people having this ventricular tachycardia or fibrillation, which can lead to cardiac arrest. Basically, heart attack is the pumping part of the heart, which is damaged by the total blockage of an artery, and cardiac arrest is the electrical abnormality leading to the heart muscle not being able to pump or squeeze the blood as it is normally supposed to. A heart attack can lead to electrical instability, resulting in ventricular tachycardia or fibrillation. So cardiac arrest may be the first sign of any heart disease in some people. So it is not unusual for a 40-year-old, 50-year-old, 60-year-old person to just drop dead, and eventually when they do the postmortem examination, you find out they had significant blockages in multiple arteries supplying the heart muscle. The heart attack and cardiac arrest are a public health crisis. According to the American Heart Association, 356,000 out-of-hospital cardiac arrests were reported in year 2022, of which 90% of them are fatal. So if someone has a cardiac arrest on the street, they have 9 out of 10 chances of dying and not recovering. That is why it is so important for us to first identify any signs or symptoms or clues that may suggest a heart disease before it results in a heart attack or a cardiac arrest. So the major risk factors for heart disease are hypertension, diabetes, smoking, high cholesterol, obesity, and family history. If you are having any kind of symptoms in your chest, don't write it off as, oh, this is just an indigestion. This may be related to whatever I ate yesterday. That should be the last item on your list. And the first thing you need to consider is this my heart? And you need to see your primary doctor and maybe perhaps see a heart specialist to find out if you're having heart problem or if you're at an increased risk of having a heart problem based upon these risk factors which I talked to you about: hypertension, diabetes, high cholesterol, family history, smoking, obesity, and all of these risk factors. So if you are over the age of 40 years and you have one or more of these risk factors, then you absolutely need to see a primary doctor or a heart specialist, not only for your sake, but also for the sake of your family and children. The heart disease is very unpredictable. That's why I say, if you are having any symptoms, consider it as a blessing, because it is sending you some warning that you need to get evaluated, get treated before you have an unexpected or unexplained cardiac arrest or a heart attack. There are other causes of sudden collapse or sudden death. Some of them are like a massive stroke, which blocks off a major part of a circulation to the brain that can lead to sudden death. Then rupture of the aorta, or the main artery that is going through your chest. If the walls rupture, it can bleed blood, and in which case there is no blood to pump for the heart. As a result, the person can collapse and die. The third other common would be massive pulmonary embolus, large blood clots blocking both pulmonary arteries, the blood going into the lungs, which can lead to, again, drop in blood pressure, not able to pump blood because no blood is coming to the heart. As a result, that person can die suddenly. So these are some of the other causes of sudden death. But in most of these conditions, like massive stroke or aortic dissection or pulmonary embolus, there may be some history of symptoms like TIA, or transient ischemic attack, or an aorta that is dilated, that was detected on a CT scan or an ultrasound before. Or pulmonary embolus is someone who may have blood clots history in the past. So those are all some of the signs that might help to be cautious about these unexpected conditions. So ladies and gentlemen, a lot is riding on your life. Please do not ignore any symptom that you may have in your chest, no matter how insignificant it may be. But if you are in the age group and if you have the risk factors which I talked about, one or more of those risk factors, I would strongly recommend you get evaluated by your primary doctor and if necessary by a cardiologist. So hopefully you can not only save your life, but you can save your family also. Thank you so much for watching. This has been a presentation of Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. And please do subscribe to our YouTube channel, and I will see you in the next presentation.